guys, welcome back to my YouTube channel. Welcome back to another video. Guys, if you're watching this video for the first time, please consider clicking that subscription button. If you're a returning subscriber, thank you very much for always clicking in. Make sure you watch this video up to the end. You can like my video, you share, and you comment. And don't forget also to turn your notification bell, because every time I upload a video, you will get notification, or you will get notified. So guys, today I want to talk about 6 mistakes that medical students will always do, and then they keep on saying that medical course is hard, medical course want a lot of your time, medical course sometimes is hectic. So guys, let's get into the video. And so number 1, which I'm going to start with, is lack of planning. If you get into medical course, or if you get into medical school and you don't have planning, or you don't start planning early time, you will get that every time you will get into problem, because maybe sometimes you will not have time to read, you don't have time to do assignment, you don't have time to do other things, like when you are a nurse or when you are a nursing student. Sometimes you usually go to the clinical ward and you take a lot of time there, when you can forget even up to read or to study by yourself. And sometimes you get that when exams comes, you fail, and then you fail, it will bring you to another problem or another mistake that will cost you a lot if you fail. This is the second point. Failing exam is another mistake that a medical student will always do. Okay, failing exam is not bad, but if, for example, you are doing 20 units and you fail a half of the units, automatically sometimes I'm not saying always, you will get demoted, because when you have a lot of supplementary exam, usually you don't have time to read, because the school does not provide extra time for you to read. They will always continue planning or organizing other activities, and also maybe they will expect you to be in another class or in the clinical ward while you also have the supplementary. So you have to create your time and read for those supplementary very well, so that you pass them, because if you don't pass them, then again it is another problem. You can get demoted, because in medical school you always have first attempt and second attempt, and if you fail, they will demote you, or you will have to look for another school, or you may even drop out if you are not strong enough. The third point is peer pressure. If you are joining a medical school, please don't get into peer pressure, or let not peer pressure interfere with your daily activities or with your studies. Sometimes you get that when you are joining the college, you are always innocent, you don't know anything, and you get that when you join the college or the university, the first week, the second week, the third week, you're already into peer pressure. You start drinking alcohol, you start going to club, you start partying, you forget your books, you don't do anything. The only thing you think of is only how you can jibamba, and this one will bring you in these activities, all these peer pressures will bring a lot of problem to you, because you get that if you get into this peer pressure, you will not get time to study, you will not get time for yourself to plan and the activities, so that you get another time to study. You will always having problem with the nurses and the doctors in the clinical area, because we are not able to attend the rotation the way they are planned or the way they are scheduled. You will not have time even to study to do extra study. You will always get into problem in discipline cases because of peer pressure. So then the third thing that you are supposed to avoid is peer pressure, because peer pressure can bring a lot of problem to you. You can even become addicted to these bad drugs that always interfere with the mental health of a person. And also peer pressure can make you even drop out of school. also avoid peer pressure if you know you are a medical student. The fourth point is copying exam. If you have been found, if you are a medical student and you know you don't know how to copy, please even don't try, because if they catch you, if they get that you are copying exam, we will automatically be demoted 1 year or 6 months behind, or you can even get expelled from school. So don't copy exam. Always read, plan yourself, read well, and when exams come, you will be able to answer. At least you will be able to answer a half of the question. That means you will get at least 50% if you are in KMTC. If you are in other medical private hospital or schools, they will, according to them, maybe they can put the pass mark they think that their students are capable of getting. But in KMTC, you are supposed to get 50%, and don't think that 50% is always easy to get. You have to sweat for it. It is not just you will go to class and then boom, exam, and then boom, you get your 50%. So make sure you read well, and then you avoid copying in exam. The next point is indiscipline. If you're a medical student, you have to be disciplined. Don't always cause issues with your lecturers, because these lecturers can make you fail. Even if you don't fail your theory exam, you can fail practical exam, because they are the one who will assess you. If you don't respect them, how do you expect them to give you marks? They will always find an issue when you are doing practical exam. So just respect your lecturers, respect those teachers, respect anybody in school, respect those nurses, those doctors, because they're the people who are guiding you throughout your course. So make sure you respect them and you avoid any indiscipline cases. Don't dodge clinical rotations, because if you do that, the doctors maybe can make you repeat that rotation. Also, they can also make you even take your case to the lecturers, and you know that when they take the case to the lecturers, they will consider that as an indiscipline case. So just make sure you do whatever they are telling you. If it is time to report in clinical area at 7:30, please do so. If it is time to give treatment, to go for ward round, just make sure you do whatever they are telling you, or do what or do as the things they usually do in the ward, so that you avoid any problem. Another thing that you are not supposed to do is laziness. Don't become lazy if you are a medical student, because laziness will cost you a lot. Okay, wait a minute. If you're a medical student, I was saying, if you're a medical student, you're not supposed to be lazy, because we always have no time to waste. You are either in the clinical ward, or you are always in the hospital. Either you are in class, or either maybe you have gone for outreach, or maybe you have gone for other rotation outside the school or outside the hospital. So you don't have time to waste. Don't be lazing around. Make sure you read, you get updated with everything in the ward, in the school, and just avoid laziness, just doing nothing without no reason. Laziness is not allowed in medical school. If you're lazy, how will you take care of your patient? If you're lazy, how will you run when someone is getting suffocated because of lack of oxygen? If you're lazy, how will you manage 10 patients at a time if you are lazy? So just avoid laziness. And also I don't know which point is that. And the next point that I'm going to talk about is about taking more time to take care of yourself more than how you think about the patient. This is also a mistake that you medical students always do. If you're a medical student, you usually don't have time for yourself. You only have time for the books, and you also have time for taking care of the patient. Those are the things that you're supposed, or you are always, or the things that you are supposed to concentrate on: taking care of the patient and reading the book. So getting time to do a designer clothes, getting time to do a makeup. I'm not saying makeup is bad, but it will waste time. It will waste time. It will waste time. It will always waste time. So that is why I'm saying medical student doesn't have time for themselves. So you should not focus on yourself more than focus on the patient and the books. The last point is about completing assessment and research. If you're a medical student, medical students usually have assignment that you're supposed to finish by the end of by the end of 3 years or 3.5 years or even 4 years if you're doing a course that is taking 4 years. So if you don't finish those assignments and research, you'll not be able to be presented to do your final qualifying exam and the nursing council exam. So make sure you finish those assessments because they will make you not to finish school with your colleagues. Always, if you're a nurse, I will always give the example of nursing course because I'm a nurse. So if you're a nurse, when you join the course after doing the medical case conditions and doing the communicable conditions, they will always want you to take a case and then follow that case even after that patient has been discharged from the hospital. So if you are a nurse, after doing the medical condition, you're supposed to take one case of a medical condition, then you start following that patient from the hospital up to when the patient will get well. And you get that sometimes some students usually ignore this. If you ignore this, it will cost you because they will not be able to present you to do your college final or to do your nursing council. Research is also another issue that you're supposed to finish before you. After you have just done the research theory, you're supposed to start doing your research on the topic that you are interested on. And if you don't finish the research by the time you are being presented for the exam, then they will not present you. So make sure you do the assignment the way the school want, because if you are in a medical, if you are in a private school, they also have their ways of doing those assignments. So make sure you just follow what they are telling you about those assignments and research. So guys, thank you for watching this video. Let's meet in the next video.